Good morning.
Voting in online.
It is 9:01. We're going to call this meeting to order. We have an established quorum with Dan, Wen, and Smith, and Brandon, Blake, and myself. So the first order of business is the review of the agenda. Any comments, questions, revisions? Hearing none, the agenda is hereby in effect. So the next order of business is the approval of the January 13th meeting minutes. Can I get a motion to approve? And second?
And second.
Second, okay. Any discussion of the meeting?
Vote on that.
Of the
Should
minute?
vote on that. On the minutes.
Yeah.
Oh, we discussed it. I'm sorry. Bear with me. I don't feel really well.
Okay, fine, fine.
Who's sick?
Hearing,
Quite a bit.
We'll stay with you.
hearing, none.
Sorry.
All those in favor of approving the minutes, say aye.
Hi.
Aye.
Aye.
Any opposed? Okay, passes unanimously. Next order of business is public comment. Do we have, Mason, do we have anybody?
No, it doesn't look like it.
Okay. So there's no, public comment. So then we'll move on to unfinished business, and that would be the first order of that business. Unfinished business would be the update on the vacancies, particularly for sanitarian.
So, I did end up offering the job to somebody and he did accept. However, DOP came back and said that we couldn't hire him under that job posting because the initial job posting was posted more than 6 months ago, even though it had been re-advertised twice, most recently in December or November. So I was 10 days outside of my ability to hire him. So we ended up offering him a temporary employment and he has started going through training, but I did just re-advertise the position because that's what I have to do. I have to re-advertise the position and re-interview for it. So he'll be applying again. It just opened today for the new posting.
A classic example of bureaucratic red tape being a pain in the neck.
Yeah, it is what it is. I did find somebody and he was willing to take it on temporarily until we're able to actually re-interview and
Can you be treated as a full-time employee in all other respects?
pretty much, I mean, he's temporary, he won't have benefits or anything until, but he's young enough that he's still on his parents' insurance. So
Oh,
he's not too concerned about that right now.
And the time frame of getting him on, even as a temporary is important because the training is just
Yeah, it
started.
started last.
And it's gonna be 6 months till the next one's
Right.
available.
Right.
So
good. Well, well, that's a relief. Brandon, you want anything?
Yeah, just the DOP, just for the new guy, Department of Personnel,
Oh, yes,
I'm not
Division of Personnel.
Division of
Yeah,
Personnel.
West Virginia Personnel, so we are under them as far as all of our employees for hiring for the policies that we follow with personnel action.
Got it. All right.
so there are options for temporary people that we can hire without going through them, and we still have to follow guidelines.
Well, we still go through
Yeah,
that.
but it's not the same process, so that's something we can do quickly, but they don't get all the benefits and.
Yeah. And with the temporary positions, we don't have to advertise them
Yeah,
and go through everything else that we would normally go through.
But he can apply immediately after you reposted it.
Yes, so today I reposted it, so as soon as we get his computer access going, because we're having issues with that right now, he'll be able to apply.
Good golly.
yeah.
Okay. Next door, I think that's it for the.
That's it for the sanitary.
Okay.
We also are looking to hire a social worker and peer counselor for the youth program. Yeah, those are kind of things too. So,
That's peer counselor for the opioid program. Right, very good. Next order of business under unfinished business is the increase of clinical visit fee, discussion, action.
So everybody should have received last meeting. It was a $10 increase in clinical fees in and around doctor's visit fees. And the reason being with that was to make sure that we capture all of the increased reimbursement rate that Medicare is providing. So, we talked about this before, and I know Brandon understands that you actually have to charge the amount that Medicare is willing to pay up to actually capture the amount. So the $10 increase allows us to capture that little bit of an increase.
Medicare likes it when you don't.
Yeah, they like it when you don't, of course.
So if you don't increase it, you only get the percentage of
Oh,
whatever. the
it
fee.
is, that's your building, correct?
and our expenses like everyone else's are going up.
Yep.
Oh, yes, they sure have.
So everybody received that last meeting. I didn't print any off this meeting. Forgive me, I'm just not that sharp today. So,
So we need a motion to increase those fees.
correct.
Is it,
And about
is it exactly $10?
$10 on 2 different line items. Yep.
Okay, I move that we increase the clinical visit, $10 on 2 separate line items.
We have a second.
I second.
Okay.
I second.
And any further discussion? All those in favor, please say aye.
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 Any opposed? Passes unanimously. Okay.
That was funny. I like that.
New business. As we do every meeting, we have the esteemed Charlie Howland, CPA, Cox Holiday Young.
All right, good morning, everyone. We have 3 months of financial statements to go over to will be voted on. That's November and December. And we have January preliminary. So as far as key metrics for November, bank balance as of November 30th, $563,000. And in compliance with reserve requirements in excess of $219,000. Accounts receivable, $72,000. And of that $72,000, $7,000 is related to West Virginia Treasury.
Why do you think we're in such better shape than at this time last year? I mean, really, in terms of the.
Yeah,
receivable.
West Virginia Treasury.
Yeah,
Yeah, last year this time it was
they're getting.
like $100,000 plus.
Right. Oh, good. So they're getting on the
Yeah.
ball.
Yep.
Great.
We'll see, that's gonna go up and down. We'll see an increase. I believe it's January it increases. But everything else in receivables is less than $1,000. Then looking at the numbers. So as of November, we're almost 42% through our fiscal year. And just looking at the month of November, we had revenue of $26,700. Then we're gonna reduce that by salaries and wages and operating expenditures. Salaries and wages totaled $79,000 for the month, and operating expenses $31,700. So that gave us a deficit for the month of November of $84,000. Year to date as of November, revenue $357,000, reducing that by salaries and wages of $385,000 and operating expenditures of $144,500, giving us a deficit year to date of $172,000. And, I know it's a large number, but that's, we're very cyclical in, the way we bring in money. And this is usually the time we see large deficit.
How does it compare to last year?
That is a great question. I know that we had a large deficit. I don't remember the amount this time last year.
It's in line.
Is it not?
It's in line.
All right.
Is it an every year thing?
Yes.
Yeah.
Our strong revenue months are towards the end of the fiscal year, March through June.
Correct.
No, I realize that.
No, we should pay attention anyways.
Yeah.
Absolutely. Overall, if we're comparing these numbers compared to what we budgeted, revenue is below target by 18%. Salaries and wages were below what we budgeted by 10%, and operating expenses were actually above by 14%. Some of that's because, as far as operating expenses, the biggest thing in there are the vaccines. Any questions on November financial statements?
Well, salaries are down 10%. Is there any particular reason?
Budgeted for employees that have not been hired yet.
Is the government still paying or reimbursing us for those vaccines, or are we paying?
Of the, COVID vaccines, so that's still free. Don't know how many weeks that's gonna remain. And we are able to charge insurances for the administration, for the cost of the vaccine. I hear that it's gonna be some per, but how old it's gonna be.
Yeah, we don't know yet. We'll pay for all other vaccines, so eventually we'll have to pay for this one.
Now, some vaccines, like for children, we get them on the vaccine for children, for those who qualify financially for that. But it's a big part of what we administer, but not budget wise.
So we apparently have caught up with billing insurance for a lot of those vaccines, because I just saw one that I got here finally came through my insurance.
Yeah, so there is a mismatch. We put out the expense, the money for the vaccines, then it takes a lot of, write that money, the revenue.
We are caught up through December billing, and probably be done soon with January. And unfortunately, the checks have started coming in, and it's not easy to post individual $40 checks when there's hundreds and hundreds of them. So they're slowly hitting the books, but when you only have 3 or 4 people posting them, it's tough. So what I had done was I had hired an insurance billing organization that was able to catch up from the June through December billings and process those before we lost them. Because 6 months for Medicare.
Is that what it is?
Yeah, 6 months for Medicare. If you don't process it, if you don't make a claim within 6 months, it's gone. So you can't make a claim. So we had to make sure we got to all of those checks have been coming in now for the last month and a half and 2 months, and it's very overwhelming. If you're familiar with Wendy, she works very hard. However, that's a lot of checks when they're coming in, and hundreds and hundreds of them at $40 a pop. But they're hitting the books now, which is nice. The revenue should grow.
So do we need a motion to approve those, or
We do review December for.
I would like to, if she could do both, and then we make a motion to approve both.
All right. Am I getting you guys enough information too much?
No,
Not
this
enough?
is good.
Okay.
In fact, just some of the other comparisons would be useful so that we get a context.
Yeah, I can, one of the things I could include in the financial packet is a profit and loss comparison. Okay. Because we do that for the balance sheet. All right. December 2022, bank balance, $417,000. We're in excess of our reserve requirements of almost $63,000.
So that's a drop of over 100,000 month over month. Okay.
And we can go over why that is here in a moment.
Okay.
And, accounts receivable did grow, it's December, not November. So accounts receivable as of December 31st is $184,000. Average days to pay, almost 31 days. Significant receivables include West Virginia Treasury of $116,900. And everything else is less than 10% of your balance. Then looking at the month of December. Revenue for the month, $133,000, reducing that by salaries and wages of $119,000. And that's a little higher than, like, if you look at prior month, because there were 3 payrolls in December. And then operating expenditures, $33,000. Yes.
What I noticed is that our bank balance is down, $150K or so.
Mhm.
And yet our assets only declined by 22,000. So what is the offset?
Accounts receivable.
Yeah, the accounts receivables up, so that means, our revenue number is $100,000 of that, $111,000 of the revenue.
Right.
Hasn't been collected in cash yet. But we had the 3 payrolls and so we had $100 and almost $50,000 in operating expenditures. Or in expenditures that the cash actually did go out.
So is that the reason the bank account's lower this month, is the 3 payroll periods?
That's the biggest reason, yes.
And then.
And then we also had, yes, and we also had some more vaccination expenditures, that was $8,000. And then we had we paid for some racial disparities expenses, but we'll be reimbursed for those. That money just hasn't come in yet.
That's a grant funded program.
Mhm.
So it's a quarterly billing, so we spend on a monthly basis, so recoup it.
And most of that receivable is still from the treasury.
Most, yes.
Yes.
So, out of the $183,000, 117 is, due from West Virginia Treasury. And 100 of that will come in January.
So a lot of these grants, most of them, we have to incur the expense before we can do it, so there's this lag.
All right. So left off that there was a deficit for the month of December of $19,000. Year to date. Revenue of $490,000. Salaries and wages, $500,000. And reducing that more by operating expenditures of $178,000. So at the end of December, there's a deficit of $192,000. Yep, and then overall, looking at our year-to-date numbers compared to our budget. Revenue, we're still below target by 18%. Salaries and wages were below what we budgeted for that expenditure by 8%. And operating expenses were above what we budgeted by 19%.
Sounds like they're a little bit squeezed about it.
Yeah.
Revenue projections are below and the operating expenses are above. At some point, they start keeping the issues.
How much of that's the third paycheck is gonna be over 19%?
We are looking at about 40,000.
The payroll usually runs between 33 and 40,000. So you throw an extra one there and whoop. Bi-weekly, yep.
Yeah, I mean, really, there was a deficit for the month of December of $19,000, but you had 3 payrolls in that. That's
Yeah,
not too bad.
Nope.
Especially compared to the prior month with the $84,000 deficit.
Right, those things are good. Instead of for.
That, unless you have more questions for me, that is November and December.
So then before we go to January, as for, Nancy Smith's, suggestion, we get a motion to accept these.
I move we accept the November and December financials.
Second, you'd be the only one, because Andy's not
Oh,
gonna do
yeah,
it.
I agree.
Because I'm the chair.
Yeah, I
Okay.
second.
Okay, any further discussion? All those in favor, please say aye.
Aye.
Aye. Any opposed?
I abstain from voting.
One, abstain. Motion passes. All right, let's move on to January.
All right, preliminary January statements. We're seeing a little bit of a turnaround in January. Bank balance is $433,000. In compliance with the reserve requirements in excess of $62,000. We still have, so accounts receivable is $178,000. And of that $178,000, $111,000 is West Virginia Treasury. They did pay $100,000 in January, but we had an additional receivable that's in this number. So there was some, so they did pay off amounts that they owed us. There was nothing else above 10% of the receivable balance.
On the receivables here, I know that the individual line items, nothing goes above the 10%, but in aggregate, that 67 is about a third of the total AR balance.
Correct.
What's the aging on that?
Oh, and, the aging on that, I think it's kind of a mixed bag. Some of it's a little older, but I'd say most of it's current.
Okay, like within 90 days?
Yes. Oh, yes.
Majority is within 30 days.
All right. Yeah, I guess that's where I was going with that. As that ages out, it may get harder to
Yeah.
collect.
Absolutely.
And what's the risk on that over time? It sounds like.
Right. If there's anything we need to write off.
Okay, great.
But yeah, most of it's current.
Okay, thank you.
So it seems like, except for that, bulge in December, that we generally maintain around a 60K cushion above our reserve amount. So that's pretty good.
Yeah, we were within what, like 14 or 15,000 last year. It's not-
Yes.
When we first. So it was much different time.
Yeah, we were, sweating last year.
Is that a requirement imposed by the state?
It is.
Yeah.
And what happens if you fall below it?
Is
Have
that-
you ever?
I'm not familiar with it ever being,
Okay.
ever going below it. I would make drastic changes.
Okay, there would just be operational
I would
changes.
go
so
over that.
That's not an option to fall below that.
No, it is not an option. I would start making either personnel cuts or other types of spending cuts, preferably not personnel, because we want to make sure that we can, continue the programs that we're required to run. But yeah, cut back on other spending, get back a little bit.
Time to tighten the belts when you
That
get
happens.
to that point.
Yeah.
Okay.
Of course, a big factor is how much of the receivables are expected. So if we got 300,000 receivables, then
Right.
we're not as anxious as far as laying people off.
Correct.
If we're have almost no receivables,
And it's looking
Yeah.
bad.
And every
Once we're
month the
rescued-
reserve's going down. Yeah.
And that receivable primarily rests with the state, which is in pretty good financial shape there.
For now.
Right.
Thank you. I mean, that's-
Never underestimate their ability to miss that.
That's real life, unfortunately.
Right. Okay, so,
Then just a quick analysis of the month and year to date. Revenue for the month, again, January, we're 58% through the year. Revenue for January alone, $122,000. Salary, reduced by salaries and wages of $85,300. operating expenditures of $13,000, giving us a surplus for the month of almost $24,000.
And just on.
What was the ops
number again? Go ahead.
I'm sorry. The ops number was how many days?
Operating expenditures,
Yeah,
13,000,
and our surplus was what?
20, almost 24.
Was it minor? I'm sorry.
No, that's quite okay. Those numbers that you're calling out, that's not here, right? But for the P and L, we just have the year-to-date number and you're reporting out the monthly
Yes.
number. But next month we will have that compared to the last year.
Yes, I'll give you a
Going
profit
forward.
and loss, comparison.
Okay,
Yes.
all right, great. Thank you.
And we
And-
call it P and L only because that's what QuickBooks.
Yes,
Yeah,
yeah.
yeah, it's a budget
For us,
surplus,
it's- yeah.
budget.
That's
Yeah,
there.
surplus
Yeah.
versus that.
I don't remember that.
Yeah.
Yeah.
Remember that for the not.
Yeah, you're correct.
The
Yeah.
not-for-profit organization.
Yeah, that's it.
Bear in mind.
QuickBooks won't let me really change the report name.
Yes.
It's a terrible program, but it's the only one.
So, year to date. Revenue year to date. $613,000, reducing that by salaries and wages of $590,000, rounding up. And operating expenditures of $191,000. That gives us a deficit year to date of approximately $168,000. Overall revenue is still below target by 18%. Salaries and wages below what we budgeted by 10%, and operating expenditures are above what we budgeted by 16%.
That number's coming down.
That number is coming down.
There's a lot of forward buying, especially when it comes to childhood vaccines and things like that, and some technology equipment also.
You know, it's funny because I know somebody who works over in Loudon County in the school system, and the same school proposed in terms of the construction costs and tax and others was up to 55% from 4 years ago. Pretty amazing.
That is amazing. That'll hurt you, buddy.
So, the one thing that I do just want you to think about, I'll put the surplus deficit comparison in the packet. We keep on building on the packet, and that's great. It's a lot of useful information for you, but just keep me, in the loop on what you think is useful and what is not, because I don't want to give you a 20-page packet that isn't useful to you. So.
Right, in terms of the board, just in terms is contact, so we
Yeah.
know where we are in
Yep.
the time flow of things, so that's the new thing, because most of us weren't here 5 years ago. or 4
Absolutely.
years ago, and, you know.
Yeah, so
Appreciate that.
I just always want that
Lipstick.
one financial packet to be useful, so you can, help manage.
Yeah, I think it's a really good package. I think having the monthly breakdown, because when you're going through the numbers, not being able to see that.
Yeah, I create a spreadsheet every month
Yeah.
for myself. I'm happy to share the spreadsheet with anyone that wants it.
You sure the beginning?
Well, that's excellent.
Yeah.
Yeah, I think we actually begin to affect the turnaround about a month early compared to last year. So makes me feel a little bit better.
Yeah, well, sound financing is really important.
Last year, I think we were even delayed. I think it really started turning around more April last year.
When you mean turning around like the end of year,
Yeah,
Revenue
Uptick.
versus expenses.
so when that surplus starts was later in the year, it's starting in
But
January.
Virginia was paying their bills.
Yes, yeah, so West Virginia's been paying their bills, but also the insurance billing helped a lot too. And also we incur a lot of expenses in the first 2 quarters. Generally clinical expenses, but also like I said, technology expenses, and computers, things like that.
And how's that going? If it was an internet like bandwidth
I
upgrade?
will talk to you about that in a minute.
Okay, fair enough.
And you're hoping that the environmental fees, this spring will be able to be more conveniently paid by.
Yes. I would mention that in the administrative report.
So, does that conclude your?
Yes, I am done. If you have no more questions for me.
Well, here's the only question I have, is that, do we need you for the next item of business, which is the fiscal year 24 budget proposal and discussion?
I think this is so raw at this point in time. That you and I have discussed it.
Okay,
But it's so raw right now, there's still some, potential revenue that's excluded. And I'm being extremely conservative, just like I was last year with the budget, and, it's a scary number, so without including all the revenue that I know that we will probably have coming in, I just want to make sure that, we're as conservative as possible when it comes to this number, but I have a paper for all of you. I don't have one for Ann. I will make sure that Emily gets a copy as soon as I get to my desk. I'll send her an email one, but this will give you something to chew on over the next month as we start getting closer and I start refining the numbers a little bit more. All right.
okay.
It is small. Break out your black opals.
So the question is, do we need, Charlie?
Maybe for a minute.
Yeah.
Okay.
Hang out here for a
Thank
minute.
you. Hi.
So a couple things. I'm anticipating a roughly $80,000 surplus by the end of this fiscal year, the way things are headed. It could be greater than that. It could be greater than that because currently February 15th, we'll be billing out 3 large grants. One will be the previous what's called an ELC grant. Another one will be the environmental health grant. And
So you're projecting an $80,000
surplus for this year.
for fiscal year 23.
Yes, sir.
Okay.
Thank you.
And I wouldn't be surprised if we hit that and then more, because last year we were predicting a roughly $50,000 surplus and we hit almost 80.
Okay.
So
All right. Well, that's good.
that's good, but again, we're not for profit, so
Right.
running huge surpluses isn't really the goal here.
No.
But it's nice if we're going to have a down year and have some good years prior
Look
to
how
it.
bad some of these deficits were.
Yes, yes. Yeah.
Since we're required to maintain reserve.
Correct.
Is
Better to
that,
have a little bit of surplus.
yeah, that's what.
So what I have is that's what I expect hopefully by the end of the year. I would like it to be a little bit larger, and Gillian has just informed me that she's about to bill out 2 of the environmental grants. That's probably about $150,000 over the next 2 years though.
Well, so we should be expecting $123,000 to come in sometime in the next month or two. So from environmental grants, and then, the beginning of next year, I'll bill out probably another, 100 and a little over 100,000.
Next fiscal or calendar.
Next
Next
calendar.
calendar year.
And right now, you're below your projected personnel needs.
Correct.
So-
That's about to change though.
Well, so then, $80,000 surplus is something that, you know, might be applied to the increased personnel expense.
Of course.
So, yeah.
So
And that's one of the big items that Berkeley has also struggled, and this department did 7 years ago when they had a large surplus. It was the question, how much do you keep as extra surplus and how much do you plow back into providing more services, which mostly means more staff. And that's
Part of it, that's going to be determined by demographics and population.
absolutely, of course, and growth and population growth there. So this is where it gets scary. So roughly moving to the 2024 estimate, I'm keeping almost everything flat on the revenue side. Roughly, where it gets a little bit rough is when we get to the other revenue. Other revenue typically was with grant money, and we were running anywhere from, $100,000 to $200,000 in additional grant money on a regular basis. So on the last couple of years. So Probably not going to be getting that grant money anymore. We're gonna try to spend, I'm asking the staff to try to spend down as much of the remaining grants that we have from the state of West Virginia and from the federal government over the next 2 quarters and get as much in the bank as possible, obviously ethically and morally, but to make sure that we hit all those grants before they expire and try to get as much money in the bank leading into 2024. Where we really get hit in 2024 is personnel expenses. We are now fully staffed outside of a full-time nurse director. Outside of a full-time nurse director, we're essentially fully staffed, and outside of being able to provide for the QRT, the quick response team, or the opioid grant, which would require a social worker and some peer counselors.
So your current, what was its employees at the end of the year 2021? I'm assuming 16. Right?
Correct.
So what do you,
One more full-time nurse.
So what do you have now?
17.
You have 17.
Yep.
And your estimate is you're gonna probably have 18 or 19?
Probably 18, and then a few part-timers
Okay.
to fill out the squad. So
Okay.
now we're talking about, instead of running about a $900 to $1 million personnel budget, we're probably running about a 1.1, 1.15, something like that. And that's really where it starts to get sticky. So we have to make sure that we hold the line on regular expenditures and things like that to make sure that we don't run what tentatively right now could be $190,000 to $200,000 budget deficit.
So you're talking about, over.
Why do you think no grants?
Because all of that ELC money, all of the big COVID grant monies, all of that is going away. That all expires at the end of fiscal year 23. Like I said, we want to try to take advantage of those grants and use them as much as we can within, we're only allowed to hit them with certain things because we are receiving payment for doing vaccines, vaccinations. So we need to make sure that we are doing it legally, we're doing it properly and all those things, but still try to get as much. So there's about $200,000 left on that one grant. It was a 3-year grant, about $200K left, and it was about $500,000 grant. And so we've spent a little over 300. We need to get some more.
The amount of COVID services going forward is likely to be very small.
Yes,
So it's, much of that money may never be realized.
absolutely right. So we have to be careful. We have to be very ethical to make sure that we're doing the proper things, but we will do our best to try to, for lack of a better word, exploit those grants as much as possible and put us in a sound financial position at the end of this fiscal year moving into 24. I did not include the environmental grant in the other line item here. That's where we usually list grants. I didn't include that, and that's a good chunk of money. And I didn't include the threat prep is in there, but that's actually going to go up about 10%. So that's an additional roughly $10,000. I didn't include that. That's already been baked into the future threat prep grant.
Okay, so
So I'm trying to be very, very conservative with revenues.
I like to look at trend,
Yeah, absolutely.
and revenue is increasing, incrementally looking back here over less than a decade. And the huge increases in terms of the trends here is in personnel, general operating expenditures are actually declining. And then total expenditures is just up, not as much as you might expect, considering the personnel expense trends. And actually forecasting a $200,000 deficit for fiscal year 2024, and that's something that we need to kind of address, I think.
100%. Then again, though, on the revenue side, I've purposefully left out things until I can get a firmer idea what the numbers will look like.
But you're looking at roughly 90% increase in personnel expenses in less than a decade.
Yep.
And that's
Nearly a double.
Yeah, that's quite a lot.
Yep. Several reasons for that. I think we understand that it's not easy to get able to employ people people with the current inflation rate, and also nurses.
Absolutely.
Nurses' income, as Brandon, I'm sure knows, is probably nearly doubled in the last decade.
And that's probably now, which we might have peaked in terms of, the tight labor market.
Oh.
It's been tight, but that, you never know what going forward.
Never know.
We're going back to 2016 and I've been here that long.
Yeah,
We've been extremely short-staffed.
yes, and
And that's one reason that the personnel number is much lower. We have struggled with staffing since I've been here.
but it also had an impact, if you look at the clinical revenue numbers, it has a huge impact on our ability to provide fee for service when you don't have enough
Right.
staff. And so you see the personnel go up and you see a noticeable increase in clinical services revenue, so. I'm not saying that having nurses is a moneymaker, we're providing services that we do, or it's a moneymaker, but you can drive revenue a little bit on the clinical side by being properly staffed.
Right, and the environmental fees. as well.
Yes, and Gillian will be able to have a better feel going forward as vis-a-vis the environmental fees. Once we start seeing what happens in March, April, May, that might make a huge difference. If it's incredibly positive post-COVID, and then I'll rework the numbers around the revenue expectations. But as of right now, not including some things that I know are coming down the pike, like the environmental health grant, things like that. You throw that in there, now we're probably talking more like $120,000 deficit, but
Which is still
still valuable. Oh my gosh, yes, absolutely. I don't want to be the person who runs $120,000 deficit, so we'll address this.
so there's only two ways to close a cap like that. And it's either you reduce expenditures or you reduce revenues.
Or a combination of the two.
Or some proportion of each.
Correct.
Well, and there's a third way in this particular business is that a good number of our services are things we do not get reimbursed for. And, but they're mandated by the government.
Yep.
So that,
Unfunded mandates.
so,
Yes.
and so that's, and that's some of the drop back in 2016 is the state revenue decrease that it picked up a little over last year.
Right.
And then the county commission had, I don't know what year they stopped.
Same year.
And getting,
I think it was
some money
before
in
that.
addition to the building.
End of fiscal year 2015.
And, so that's variable for different counties as far as, which ones contribute, but that is, one of the things private businesses don't have is.
Correct.
Certainly for non-for-profits, those gifts are important.
Two things in and around that.
Still though, it's revenue.
Yeah, two things in and around that are one, we're hoping that, and it's looking possible that there's be a restoration of the remaining roughly 13% of state funding that has been cut. So they cut it about 27% in 2016, state funding to local health. And they restored about 12.5% of that. And roughly half of that cut has been restored, and that was restored last year. And we're hoping that they restore the rest of that. That would all probably about 60 to 80K. Okay. 60K or so to the bottom line. And I also put in I will put in a budget request with the county commission to restore our funding from the county. We're one of the few counties in the state that does not receive county funding in some manner, either through a levy or through a line item in the county budget. One of the few counties that does that, and which is kind of disturbing to me since we are in the wealthiest, most educated county in the state. But they make no contribution other than use of this building. Prior to 2016, they contributed about $200,000 a year.
Do they pay the utilities here as well?
They did.
And
That comes out to about $68,000.
the unfunded mandates, those state,
Yes.
okay.
So one of the big ones recently was the requirement that local health be involved in for preparedness. And we'd always had a preparedness officer. That was pretty normal for a health department this size. But now it's a mandated program. So that position is funded by a CDC grant. That's a pass-through grant from the federal government to West Virginia, to the state of West Virginia. And that's how that position is paid for.
That's
But now that it's mandated, if that grant mandated, if that grant dries up, we'll be forced to pay it out of general revenue. So
Yeah,
that
it's
can
another
be tough.
That's another source of stress.
Yeah, it is indeed.
Is,
And that grant more than
revenue
pays for
streams that
basic
matter.
salary.
It does, but it also pays for other things that are required under the law, like updating emergency radios and all those things, keeping those things prepared, and those aren't cheap. So, but it also pays for people's salaries, you know, the time when they have to attend trainings and stuff. You'd be surprised at the level of threat preparedness trainings that are required for the staff areas.
Most of these
Amazing.
mandates, we agree that we should be doing it.
Well, they're gonna pay for it.
But we don't agree with some of the inefficiencies. But actually provision of the services.
Yeah.
Yeah.
It makes sense.
But it costs, especially if you have to be able to staff it all the time. It's not something you, and it may not be something that's, every day you need to do it. It's just a regular need for certain services.
Now, we're lucky, we have a good threat coordinator, but he doesn't work for free. So, depending on what happens with that grant in the future, you know, that could definitely hit us into the tune of $70,000-$80,000. So we'll have to make sure that continues to come as a pass-through grant from the federal government, which would be wonderful. So what you're seeing here right now is not the final numbers. This is just,
Understood.
as a salesman, I would always under promise and over deliver. That's what I did last year. I'm gonna try best to do that again this year. So, but as of right now, we're probably looking about $130,000 to $200,000 deficit, just eyeballing it as of right now, without knowing what our revenues will look like in the next 3 to 4 months.
And this needs to be done by May, right?
Yeah, the last vote on it, the final vote that would be done would have to be the first meeting in June. We will get it done by May, just like we did last year.
Is there another round of approval outside of the board members here? I mean, does it go to the state for approval?
If there's not,
County?
you are responsible. Ultimately, it's you and I. are
This is the
responsible.
big part of our job.
Okay, and
This
then,
past year, they stopped the state requirement.
okay, all right, and then is the goal to submit a budget that's not negative, or there will be budgets years that are negative?
I imagine my goal would always to be within positive or negative $20,000 to $25,000. Unless I run 25,000 negative, 25,000 negative, 25,000 negative, then it would obviously change. But if it's up and down and consistently around a zero sum, that would be my real goal. It's nice to run a nice surplus. That's very good. We've run one for the last few years. Especially when you look at the old ones and it's all deficits.
Generally speaking,
We
when
run
you
that.
submit a budget, you want the revenues and expenses to match.
Yep.
That makes sense.
Right.
Yep.
Then obviously you're gonna have a pretty good surplus going forward to also help feed some of that deficit.
I prefer to run a small surplus next year.
So,
But this is
Part of that.
nothing to be voted on. This is just something that you guys have your eyes on, and then I'll come and I'll adjust the numbers based upon what I'm hearing from the state, what I might be hearing from the county, what I might be hearing from grants that are coming down the pike, including some of Gillian's grants. You had made a note to me, so like, remember, this is coming in. I know you didn't put it in here, and I haven't yet, so. But as of right now, we're looking at a possible deficit fiscal year 24. I hope not. And I'm pretty sure we won't, but it's possible.
okay, so, then does that conclude your, discussion?
It does. And there's, sorry, I put action there. Probably there's really no action except for,
No, I
get it straight,
I didn't, there's actually, there's no action. Oh, well, I see, yeah.
Continue to develop, yep.
Yes, okay. I'm gonna apologize, but I'm gonna take a 3-minute break. Thank you, Charlie.
Thank you, Charlie.
No, it was just an earlier.
Okay, so we're back to recording again, and nothing happened. All right. Next item is the agency activity reports and discussion, and the first one is the environmental activity report.
So you guys should all have a copy of it in front of you, for our numbers. So it looks like a total of about 147 inspections last month, including septic evaluations and food inspections. The food inspection number has about double, and I'm hoping that comes up even more this month, or for this month's numbers. So we do have 3 people now able to do those now, 3 other sanitary. So, and it'll be a little while before Daniel's ready to go, but as long as we get him hired properly. I'm trying to think if we had any trainings last month. I don't think we did, so. But I did go with Gino to the Public Health Day for the legislature, so we were at the state capitol on Wednesday, meeting with, Amy Summers, and meeting with the Association of Local Health Departments and our lobbyists for that association. So, we tried to meet with some of our delegates, but we didn't hear back from most of them.
Who is Amy Summers?
She is the, Health and Human Services
Committee chair.
delegate, yeah, committee chair.
Yep.
Yes,
And we're just,
so.
privilege, yes, so she's the House Committee for Health and Human Services, so that would be any funding or anything that originates in that committee to come out of there, so definitely a good friend to have. So one of the, go ahead, I'm sorry.
So that was interesting for, as far as the environmental health legislature that we're concerned about, the West Virginia Association of Sanitarians, which I'm an executive member of, has voted to oppose the bill that was introduced in the House for, eliminating, local health department's ability to require food handlers cards, which we do here, and it is a source of revenue, but it's also a good training that we want people to have in place that are handling food. So we're hoping that bill doesn't pass. So that's.
Do other states have this as well?
Do other states?
Have food handlers cards? as
They
well?
have, yeah, there's requirements. I actually served on, with NEHA to revamp their food handlers test. So I was part of a group that was organizing that, and NEHA is the National Accreditation Agency for Environmental Health. So there's a national, there's different, it's not just West Virginia that requires food handlers cards, so, yeah.
How are we doing with, do we still have the moratorium or the amnesty for short-term rentals?
No,
That's expired.
right, so we're having to, right
How
now,
many
we're,
people have come in under that program?
so last month we had 7 new. And the month before that, 6 new. I think it's a total now of about 70, maybe a little less. But I know we have 100 here, and
Yeah, because there's several that I'm now aware of in my community. I'm on the board of the HOA, so when people come to me and ask me about short-term rentals, of course they fall in Airbnbs, but I refer them here.
yeah, and we don't have a really good way of reaching out to all of them, so.
Yeah, that's.
What's
that's
the, sorry,
Oh, go
I was
ahead.
gonna ask what, it's an annual fee that they would need to be paying? Is that-
Yeah,
that's-
so they have a one-time upfront fee for a plan review for the short-term rental. And then there's an annual, $125 fee, I believe, for the permit for the short-term rental.
We modified it.
There's a couple hundred that aren't.
Yes.
We think there's a couple
Yeah.
hundred in the county.
Yes, I believe there's at least 200 short-term rentals in the county. And right now we've got 60, 70 permitted, so.
I think that's a
Yeah.
good estimate, by the way, might even be conservative,
Yes.
because Jefferson County become a significant tourist destination, that's probably.
Oh,
that's
People
definitely
are
on
buying
Katie's-
that property, then that's what they're using it for. so.
Yes, because regular rentals are in very short supply in Jefferson County, because everybody wants to do the short-term rental.
I was just in your neighborhood, from the YouTube.
I know. They want me to be the president of the HOA, and I said, you don't want me, trust me, that'd be hardcore.
Yeah.
Hardcore.
I'm the treasurer.
Does your HOA,
It's dysfunctional. Completely dysfunctional.
but is it against your HOA?
Yes. It's against our HOA rules, and there's a lot of things that are against our HOA rules that they are ignoring, mostly the rentals and short-term rentals.
So if we were to be able to increase compliance in that, maybe additional $25,000 in revenue per year coming in from that, but then the staff, the capacity to run.
But they're not inspected on an annual basis, or just,
It
is
is annual.
it
yeah,
annual? Okay, I don't
yeah.
know that I realized that.
And the crazy part is when they do inspect them, they do find things that are definitely out of compliance.
So it's not just taking in the revenue, all those that sign up, then you would have to go out and do inspections on them. So that would
Yeah,
probably,
everything that we.
probably more than the revenue.
That.
And that's why we did the thing back with that plan to make the regular B&B a little bit more competitive on local permitting fees.
But with regard to, the quality of the rental itself, one would think that the ratings that wind up on the internet for a particular rental would take care of, some of that. But-
Quality, yes, but we look at safety considerations too. So,
Oh,
But yeah, I mean, I think they're pretty well rated as far as cleanliness and quality on those, but.
and cleanliness is part of safety.
Right, right.
All right, anything else on the environmental activity?
Great numbers on the food inspections. That's where we've been lagging over the last few years because of our.
Those need to be a little higher than that.
He's pretty demanding to work for.
Next is threat preparedness.
Yeah, sure. So on my notes here, let's see. So on the 24th, I took the staff over to the 911 center. And they all got a little walkthrough and got to meet the 911 communications coordinator. Jeff, yeah. And he provided a tour of the whole facility, and he's also planning on doing radio training with us. The catch with that is that I have to make sure that all the staff have the required incident command training. So there's 4 required courses. It's 100, 200, 700, and 800. And those are all through FEMA. So you have to sign up for an account and go in and take the trainings. They're each about 2 or 3 hours long. So
Say 100, 700, that's dollars.
no, so that's the name of the course.
Oh,
So each course goes over some of the principles of emergency management. There's a whole lot of emergency management related lingo. Like whenever you organize a response to a disaster, you have to consider incident command, logistics, finance, that sort of those different roles and positions. And so for the radio training, it's just so that communication is like a really big thing in emergency management. And so understanding some of that lingo kind of helps when coordinating that. And so the other thing is that I'm starting like a volunteer monthly or quarterly meeting where we kind of meet up with all the volunteers and kind of catch up and review different trainings that they can be a part of. They can also participate, like come up with activities that they can participate in that we can coordinate as a health department with fire, EMS, police, and emergency management. And so those are the main points there. I think that's everything. Yeah.
Great, thank you very much.
Mhm.
And we
Yeah.
can provide for the board members to know more about these emergency training.
Yeah. So I can.
FEMA training, very boring.
Yeah, it's very boring.
Gives you an idea of how it thinks.
That's all
took the CERT training, do they still offer that?
So Dick Myers, who's like the deputy director of emergency management, he's working on getting that program reestablished, but it's gonna take some time because he has to take up in Emmitsburg, it's called the Emergency Management Institute.
Mhm.
He has to take a train the trainer course to be able to teach CERT to the community.
Okay. Very good.
So,
Yeah, because that was a worthwhile program and it was pretty well attended.
and it's something too that we can get individual health department volunteers involved with too as a training. So,
Next up is, thank you.
Mhm.
Next up is clinical activity.
We have a list in front of you. So continue in January to offer similar number of services, the number of COVID vaccines that decreased, a lot of childcare vaccines decreased because there was a surge in November, December of people catching up. We have a new family planning nurse practitioner starting later this month.
Oh, yeah, she's on board.
And
Karen's familiar with
with that.
it's Leo.
The current one is leaving soon.
March or April.
Yeah, so she has mostly moved, and she's hanging on, helping us until we can get a replacement. So we'll miss her, but we're also excited about she's allowed to retire soon. No, this is
She's my neighbor.
Linda Keeling.
Oh,
Is a midwife in this community in Manchester for a couple decades.
Yep.
worthy.
So we're doing epi. Okay. Got it.
But do you have to start getting the new one credentialed already?
She's already been credentialed.
Oh,
She
good.
just received her nurse practitioner certification, state of West Virginia. And then from there, as far as family planning goes, she's already family planning nurse. And
Good.
she absolutely knows what she's doing.
But she has to do a few state.
State mandated, yes.
um,
Once we get her on payroll, she can do all this then.
Collaborative agreements.
So that concludes the clinical activity report. Next up is epidemiologist report and our
But I
epidemiologist.
will give he prepared it.
Oh,
I'll give it. So so we're back at the first slide.
Yeah, we're back at the first slide. So this is COVID. Mhm.
Go ahead.
Okay.
So you can see that the number of cases went up a little bit in January and has decreased since. We did not have a big COVID surge this December and January, as unlike the past 2 years, where there was a big bump in the number of cases and hospitalizations next. And what's in our state, we a little increase, we'll go forward. So the number of cases since last winter has remained low, again with the caveat that the probable number of cases actually is much higher. It's now in the background, so it's probably several times above that. The problem is that somewhere around that, after the big peak in that dotted line, the number of they we counted changed, and the only way you had it before was getting an official test. But since about a year ago, the home tests have been available and used, so the majority of people who get COVID don't have severe disease, they don't go see a doctor or a bunch of cereal, they do a home test and they know it. So this count is with a big asterisk, is but it's been fairly consistent, not these big increases. And these are so that when people get very sick, then they do get the official tests, and then it's documented somewhere.
Where are the official tests being done now?
So, so no longer the free testing, a few pharmacies do the free testing, but you don't get it back right away. So urgent cares, hospital, are the main places.
But we're not doing them here.
We are not doing that. There's an occasional person that can't get a home test, and we've got some we can give out to them. Next. So the hospitalized cases, so this is just a weekly report we get of the people at that time in the Berkeley and Jefferson medical centers who have a active diagnosis of COVID while they're in the hospital. Does not tell us if they're there because of COVID or they happen to be there and have COVID. But it did go up a little bit in January, but to about 20. If you compare that to last winter when it was at 100 cases, this is manageable. Not all the cases show up here, and then some people come to the Jefferson Emergency Department to be admitted, and there aren't any beds here or Berkeley, and that's just because their population is growing and it's all growing in the hospital size. Next. Next. So these are some of the reportable cases that we've seen. So Campylobacter is a foodborne illness. The hepatitis B and C, these are acute cases. And 202 new cases of COVID documented these past months.
Are those all the reportable diseases?
Those are the ones that we get, so it's not all of the state gets some. So this is
What makes them reportable?
so there's a big list of reportable diseases. Most of them are reported by a laboratory having a positive test result.
But I mean, what,
There's a
how does the disease wind up on this?
So there's a law that says certain illnesses need to be reported. And
Federal?
federal and state, there are requirements for, and that's because you would want to know if certain things are happening. Some of them, it's because they're actually communicable, like measles, you want to know if that's going around. Other things like strep pneumoniae, it's not so much that you're going to catch that from someone else, it's just that the incidence is going up. You want to be aware of it. Things like Lyme, we're not doing anything different with that information. 20 years ago, we didn't have any Lyme here, except rarely somebody went to the beach and got it, and that's completely changed as the disease has spread. And so now it's throughout the state, and we don't actually do anything with that right now.
Right, deer ticks, so. Right?
Correct.
We have a lot of deer.
There is other illnesses that are reportable.
I can show you this. And this is quite a comprehensive list.
I'm assuming they're not here because most of them are zero.
Correct. Most of those things that you hear about on the evening news, this thing or that thing, it's like, we don't see that, and we hope we don't.
Right.
You'd start looking for it. And some things, like this one thing, anaplasma, that's another tick-borne disease that it's not usually tested for, but if the practitioner started testing for it more, they find it more. It's similar to Lyme in a lot of ways. It's not a way it's
Yeah.
Anaplasma phagocytosis.
Easy for you to say.
So so this is I gave you some national statistics. This is Jefferson County statistics on opioids over the last 20 years. I did not have last year's numbers. Maybe just a little lower. So there's not always a year-to-year answer for why it's up or down. That's fluctuation, but at least it didn't continue to go up and up and up. Next is, so of the ones that were fentanyl related, you can see it wasn't until about 2015, 2016, that really started creeping in.
Well, hopefully people are realizing fentanyl is should be quite lethal as to avoiding.
Well, so it's not easy to avoid it if you take a pill or an injection, you don't know what's in it. And it's in now, most all of these things. There are ways you can test for it. The trouble is that many people, even if they could test for it, have a substance use disorder and they're needing their fix as you would, they would use it. It's also with people who don't think they're using it, that are using stimulants. It may be mixed in with that. There are other things that are even harder. There's one called xylazine, which is what we have to use more and more. And that's an animal tranquilizer that has no human use. But it's a sedative, and it's mixed in with this problem that is Narcan doesn't reverse it if you get an overdose, and it also causes necrosis on the skin and other organs of people. It's a bad one. It's an animal tranquilizer. It's not a controlled substance. It's just not on the list. So if you haven't been on them, you're not breaking the law. But it's you're not breaking the law. RS, there were some things that there was RSV. Very beginning.
Let's see.
Yeah, okay.
Okay, here we go.
So that's the blue is the flu, and the magenta line before that was the RSV, and they have decreased to almost nothing next. And this was the flu cases that are reported by the major laboratories that do the reporting. So we're seeing almost no flu now. The hope is that we won't see any through the rest of the flu season, which is like through April. We don't know that for sure. In Australia, they did not see a second peak. It came early like this did, and they didn't see a second, so we hope our luck holds up with that. Okay. And I think that's it.
Excellent, thank you very much, Dr. You're still up with your health student.
So, talking about the short-term rentals and people buying up all those, one day last month, I participated with the Homeless Association doing the homeless count. There's a point in time count across the nation, one day in January every year, where we go out and try and count in a 24-hour period the number of homeless individuals in their community. We don't have a lot here who are identified, and homeless includes a lot of different things. It is a problem in the Eastern Panhandle. It's not as visible. A number of affordable housing is there's not making lots of new affordable housing, so I did with one of the workers. We did go out and walk through some areas of woods near town and found a few tents out there, identified a few people who so it's here. It is invisible.
How many did you come up with?
So there also were some people who were counted in the go to the shelter that Jefferson Community Ministry has. So we found 2 people in the woods, and then there were several other people. I don't know the final count for Jefferson County, but it's, so home issues have lots of,
How many people are using that, community ministries?
they might have about 10 people, and that has changed now, so it is a fixed, location, because they meet at the community ministries and get bussed over, I think about 6 o'clock. And, they're looking, I hope, to make it year round, shelter that's available instead of just cold weather. But, so it is a good service. Martinsburg does not have that. They have rescue mission, but it's a little different. We're hoping to get this opiate response program off the ground. I have met with a couple different people involved with it in Berkeley County and WVU. The idea is that emergency services, primarily the ambulance service, when they have someone who survives an overdose, is that they would let us know at the moment, waiting for our attorney to give us updated opinion on the confidentiality issues with them, letting us know. And so that's the guidance in the law is a little less than clear. So different jurisdictions interpret it differently. But law enforcement, 911, they do not have to follow the type of confidentiality because that's for medical providers. They're not medical providers. So so they can report that they're often not the ones doing the actual investigation of the scene. So there is a need from the things I showed you. There are about 22 deaths a year from opioid overdose in this community, higher in Berkeley, but per capita not that much different. There are, those are the deaths. There are far more responses by ambulance people who have overdosed, and either they or a citizen has already revived them. So there's a lot more overdoses that could be death.
Does that conclude your report?
It does.
Thank you very much, Dr. Reed. Final report is from the health administrator.
Thank you, Elliot. So, quick reminder, big grant reimbursement billing on February 15th, that's for Q2. So a lot of that will hit our accounts payable. It's I was surprised that next month has a very large accounts payable type balance, which is not a bad thing, because we are getting it in about 30 days. So there'll be a big one on that between Gillian and myself and a couple other grants that'll be billed, including the prep grant. So that'll be a nice thing. I'm reconsidering being a part of the Office of Technology for internet service and for IT support. I think I've finally been able to be in my position long enough now where I can quickly look at numbers and say, okay, that's a good deal, that's not a good deal, those types of things. It's taking me a while. It's a much more complicated job than I expected. But I think we could probably save money and increase our internet speed and then move a lot of our software onto the cloud. Whether it's our emergency or our medical records, electronic medical records, or any of those types of things, but also QuickBooks and things like that. So that then leads to the next thing. So state of West Virginia has a requirement that all state or quasi-state or local government agencies are required to be able to receive payment online via either check transfer or by credit card. That has to be in place before the end of March. I was already ahead of the curve on that and was already starting to do that in November and December. So that is almost done. We did that through BCT, and it's almost done now. And we'll have a little tab on our webpage where you just click on that and you can pay by credit card and you can identify what you're paying for and put the several pull down menus so that you can easily classify the payments.
And are the charges charged to the payor?
Indeed, roughly about 4.5% to the pay rate. Yeah, it's pretty significant, 3.99, I think is actually the final number is what it's gonna
Oh.
be,
That makes, yeah.
4%. So yes, the fee will go to the payor, not to us. But having that available, we have to try to remove the extra input step, and being able to have high-speed internet and then having cloud-based software allows that system to then integrate in the cloud with each other. The way we have it set up now, it's an extra step. You take the payment in and you put it into QuickBooks by hand, when we all know all of us receive QuickBooks receipts from plenty of places where it just goes right into the QuickBooks numbers. And so I'm going to try to figure a way to get around that, and getting away from the office technology is probably the way to go. Because it's just too darn slow and it takes too long to get response from them, and the internet service is, just not good enough. Even I am project managing it for the state. So, but yes, now you'll be able to pay your permit online with a credit card.
I'm too cheap to pay the 4%.
Feel free to write a check and send it in. So, but
I would,
once that's in place, though, we will then probably, within a year, and once we streamline everything, we'll probably be able to receive check transfer, and that obviously will have no payment fee. ACHS.
Yeah.
And that would be a nice thing for a lot of our businesses in town, I think.
I would like to
Having to
know,
come in here is such a hassle for them. They could just look through it
Right.
and set it in. Yeah, a huge amount of time for
I
them.
would like to learn how you integrate that into QuickBooks, because we're not able to do that. I don't know.
Oh. Well, I charge $250 an hour consulting. For 2 hour minimum to start. I'm kidding. Of course, everything's free. So I'll let you know how it goes, and we'll keep you guys up to date on that, but several things, Verizon and Comcast are about half the price of, not even half, about a third of the price of what the state system is.
wow.
I couldn't believe it. They were gonna charge me about $1,400 a month for 100 meg service.
What is the availability of the new Frontier fiber optics conference way?
So we have Verizon, we have Chantel, and we have Xfinity in this building. I wouldn't be surprised if we have the Frontier fiber also.
Well, they're running it right
Well,
now.
I saw them out running something to our two things, so I wouldn't be surprised if they were running those lines.
They literally were running it in my development.
And here's another thing, the flip to that is I know that the county has not chosen Xfinity or Comcast as their exclusive provider for county IT and internet services.
Okay,
So that might be something that we consider piggybacking on, since it'll all come through all the offices through the JCBA and those types of things. That's maybe something we can piggyback on with them and fill it straight up. And those are all the things that my first few months here, I could see it, but I didn't have the skill and the knowledge to be able to quickly identify this is better, or this is not. But now I can do that. So that's coming. Big changes there.
Anything further? All right, that concludes the agenda, unless there are any, extra board member comments that anybody feels are urgent or compelling. Then, the next meeting is, scheduled for March 10th. And, at 9 a.m. And, everybody have a great weekend.
do we need to move to adjourn? I
Oh,
move we adjourn.
Second.
Any discussion? Oh, all those in favor, please say aye.
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 Unanimous. Everybody have a great.
Thank you.
Thanks, everybody.
Yeah.
Have a good day. Bye-bye.
The full,